So basically, in today's class, we'll be discussing about the, like the types of letter, just an overview, not in detail, to give you a brief idea about different types of letter. One, you can say, expect in the OET writing. So to begin with, let's say starting with the referral letter. So I myself have categorized the referral letter in different categories. We might not be able to see this thing in the literature. But as per the types of letter, as per the question that has been asked by Dr. Sunam right now about the social history, about the formulation or the sequence of the letter, we can, like differentiate the letter in different approach. For example, in a referral letter, most of the time we can see that we have the diagnosis or assessment being given, right? Let's say, if you can see there, if we have the first, like we have a case when we have the provisional diagnosis, or maybe we have assessment, or the GP has made the diagnosis in the form of maybe AMI, or let's say another letter we can have the diabetes mellitus, or maybe Cushing syndrome, or simply the patient is having elevated blood pressure, and this is the reason of writing we are having, and we are writing this case to the mostly to the healthcare professional. It's very common in the medicine. We can see such letter. So we can see that in the letter, we can write down the introduction. Thank you for seeing, Mr. Mark. This is a positive noun. Now this line, this is a positive noun, the noun that describes the quality of the noun. If the profession is important, let's say, we can add profession. If it's not, we might not be adding that thing over here. So thank you for seeing Mr. Mark, a 28-year-old accountant whose signs, symptoms, and investigation are suggestive of diabetes mellitus. Okay, this is one of the format that I've discussed with you. So you can see there, I just underlined few things to highlight some of the grammatical areas. Here you can see before this relative clause, I'm using comma, and after this mellitus, I'm also using comma. So these are the concept of defining and non-defining clause in this sentence. Like this is non-defining clause. That's why I'm like separating it with the comma. Here, in the second type of introduction, you can see that there is no comma because now this is defining clause. Let's say I'm stopping sentence over here. So forget about the defining and non-defining clause for the basic understanding of the grammar. If you can see that if the sentence is continue, like in this way, we can separate it with comma. But if sentence is not continue, you are stopping the sentence over here. We just have not to put any comma over here. So we started with with this point that we have a referral letter where we have the assessment, provisional diagnosis, or diagnosis being given. It's a very simple and conventional letter. With reference to the like the structure of the letter in the introduction, you can see that we are writing that signs, symptoms, and investigation. So anything that can help the specialist first to make the confirmed diagnosis, and then further management should be written. Let's say in case of the diabetes mellitus, if the patient is having any social history, such as let's say accountant, such as you can say sedentary lifestyle, such as family history, these are important factor, and this is not an emergency referral. So we can write in second paragraph about the socioeconomic details as this narrative sports, like this case. For example, we can see that having the patient with diabetes mellitus, let's say, these are the risk factors such as you can say sedentary lifestyle, family history, and all these things are the risk factors. So accordingly, we have to organize that. Then the next paragraph, maybe we can incorporate the treatment record, just summarize the first few visits and expand the recent history. Anyhow, that is the part of the discussion will be done inshallah in tomorrow class. But a kind of letter we can say with diagnosis, a simple referral letter we can expect in the OET exam, and it's very common in medicine. It's very less common in nursing, but we can expect because we had certain example when we had the letter of referral in nursing with a diagnosis being given, a kind of letter, not usual for the nursing. Anyhow, here we can see that a second category of referral letter, when we don't have the confirmed diagnosis, they might give you some symptoms, right? They might give you maybe like situation, like it's not only the symptom, but it's a kind of either symptoms or either situation. So without diagnosis, we can expect either just symptom or the situation. So situational letters are comparatively tough as compared to the symptoms letter. So we are not supposed to make the diagnosis by ourselves then. We can just write down the way this introduction has been written. Thank you for seeing Mr. Alex, let's say, who presented with 3-week history of let's say lethargy, blood VN, and listener blood distillation showed high blood sugar values. I'm referring Mr. Alex for a definite diagnosis and further management. So you can see that I just have written the primary symptom. Obviously, this has been derived from the major from the case, that these are the major things, the major symptom patient is having on the recent visit. So I just have to write it down, those major symptoms or sign or investigations in the introduction part. We cannot write down diabetes mellitus because GP has not made a diagnosis. And say so on. If we do have the situational letter, in this situational letter, there is no symptom, but the situation is being mentioned only. Like I'm writing to refer Mr. XYZ, who insisted for you can say rheumatologist referral, as he believed that he's having rheumatoid arthritis. Please note that currently his gout episode has subsided, for example. So I would appreciate if you could further investigate or treat. So you can see there is a mixture of things going on. Patient was having symptom of gout, and that settled after the medicine compliance. Patient was insistent on RA referral. So it's not a conventional discharge letter, it's a kind of situation letter. So we'll expect some situation letter in our class practice for our better understanding. Anyhow, so followed by the differential diagnosis, the third category of referral letter. In the differential letter, we have just mentioned different type of differential. For example, let's say we have the primary issue or the primary disease, and then we have the further displays of this disease or further possibility of that cause. Let's say, not disease actually, but we have abdominal pain. This is a vague nature of abdominal pain, and we are not sure what could be the possible reason. So we can see these are the two possible reasons that is being suspected by the GP. So we can expect such differential diagnosis. Similarly, we can also suspect, okay, the patient is having obstruction, and these might be the reason of obstruction, and you have a differential diagnosis for that, and so on. So in this way, you can see that the three example I just have mentioned in front of you for your better understanding that when we have differential diagnosis, how can we approach? In the next slide, we'll discuss. And when we have two different diagnoses from like two different diseases, it can also be categorized under the you can say differential diagnosis type of letter. For example, AMI or APO, one cardiac and one pulmonary condition. And when we have multiple DDs, so we can expect multiple diseases as well, maybe 3, 4, 5, 6, and so on. So let's say, with reference to the last slide, these are some of the introduction that I have written for you. I'm ready to refer Mr. Alex, whose sign symptom are suggestive of an early bowel obstruction, let's say, secondary to diverticulitis or carcinoma, for a definite diagnosis and further management, right? There should be bowel. Sorry, I have missed that type of mistake. An early bowel obstruction, secondary to diverticulitis or carcinoma. Sorry. Similarly, we can also write it down. Thank you for seeing Mr. Alex, whose features are suggestive of acute pulmonary edema or acute myocardial infarction. So two different diseases. And go so on, we have multiple differential can be written in this way. And the fourth example that I have written in front of you, the purpose of writing this example, that in the differential diagnosis, we may write it down, you can say, the symptoms, the major symptoms, not necessary to write down the DD directly. It is important to mention over here that you have to mention the DDs, maybe in the introduction or maybe in the body of the, in the conclusion. But in the introduction, in case of differential diagnosis, we can just mention the symptoms only. Let's say whatever the symptoms are, we can mention over here, right? But in case if we have the differentials, it should be written in the conclusion of the letter. So uh, if it's clear to you, before we can proceed, I'd like to take a pause for a moment, and I will repeat for you as well. Discharge letter. No, discharge letter is one of the second major type of letter, or it's a major letter actually. We can expect such letter in the. Okay. So basically, like the major category of the letter is also a discharge letter. We have discussed about the referral. No, we will be discussing a discharge letter. So conventionally speaking, if we can just mention or label discharge letter, or the maybe the core of letter is just the follow-up. Because in the letter of discharge, no matter who is writing this letter or whatever type of letter you'll be writing, we have to pay focus on the follow-up, right? It should be majorly focus, like your letter should be focused on the follow-up plan, because the purpose of discharge is, in any category, is to write a letter to a person who will ensure the follow-up management or the follow-up care, right? Anyhow, so we'll discuss, let's say in case of medicine, it's kind of specialist to GP referral back. So GP is the primary care physician. He already knew like lot of information about the patient. And in case of nursing, the difference I'm explaining, the ward nurse might be writing to community nurse, might be writing to district nurse, and so on, right? Anyhow, so the common things that we discuss, like in medicine, as we are writing this letter to the primary care physician, so social history, family history, past medical history of the patient will be irrelevant. We are not supposed to write it down, but still, or 99% of the time, it's irrelevant. But still, you have to read it if there might be a play in the card. Like let's say if the patient uh, was admitted, her or himself, and there is something that happened maybe a few hours before, so it should be written in the letter then. Anyhow, we'll discuss that. And in case of nursing, you can see that social, family history and past medical history can be written, but conditional to relevance, number one, and sequence as per importance. There is not this is not the case that we can write down social history in priority. Most of the conventional discharge letter, social, family, and past medical history might be written at the end, or at the appropriate place as per the requirement of the task, right? Anyhow, but after that, these three things in the letter of discharge would be same. Now, whoever is writing this letter or any letter, you must have the same principle that has to be followed, such as the information as per the one question that has been asked by Dr. Madhia, that there are a lot of information in the ward stay. I was reluctant to answer that question at that time because we have to discuss over here. So now answering your question, so basically, in the ward stay, no matter how much lengthy information you will be having, maybe if you have the total history of 2 pages, history in the case notes, and there is a stay of 50 days stays in the ward, still, you just have to present an overview form. Like, let's give you an overview. Summarize the events, right? Just write eventful thing. Rest of the thing need to be summarized, because, you are standing at this point, like when you are discharging the patient would be stable, right? The patient would have been improving. So now whatever has been happened in the ward, right? For example, whatever you have done in the ward management, because you can see that mostly, if you can see in case of ward, the patient has undergone surgery and it was uneventful. That's why he was admitted in ward, right? So during his ward stay, like we have done multiple things, as you can see in different letters. There are multiple dates that describe different events. So we have to just write an overview. Maybe his or her ward stay was uneventful, apart from intravenous blood transfusion, which was done due to his or her low HB. Similarly, in case of the letter of discharge, we can see that the patient might be admitted in the hospital and there are a lot of symptoms written, blah, 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 blah symptom. So we are not supposed to write down those symptom again, because that symptom might be important at the time of admission, when the specialist had to make a diagnosis, then specialist treated the patient, and after treatment, now he's about to discharge the patient. So we have to summarize. For example, if there is a patient who has, at the time of admission, who was having symptom of hallucination and all other symptom related to psychiatry issues, so we can just summarize: Mr. XYZ presented to my clinic with worsening symptom of blah and blah, right? We just have to summarize. Anyhow, similarly, for rehabilitation, because you can see that it's less, we can say, we have to summarize it, but less from the ward or the admission detail. We have to bit expand it as compared to ward stay. you have to be expanded, but still it should be an overview form. Only highlight the key points. What I mean by the key point, if it's a rehabilitation plan, we may have incorporated stick or frame or maybe some assistive devices for exercise. Okay, so we can add those things, or we can simply write down the rehabilitation program help the patient to gain mobility, to gain the stability, whatever the case is. Similarly, for nursing management, whatever has been done in the nursing management, any therapy, any medicine compliance, it should be written in the summary form, right? It's not to be not to expand this thing. Okay. Anyhow, so after that, we have a discharge plan. So the letter of discharge, like it's as I mentioned that it's important for you to understand this is the main purpose. So in a conventional letter, obviously we'll follow the sequence we have written over here, but its discharge plan should be expanded to elaborate more in the discharge plan and do not omit anything from the discharge plan, right? Anyhow, so as you can see there, that these are the letter of discharge we discussed. Then we have the letter of request. Before we can proceed, I would like to ask you if you have any question. So let's say a letter of request is the letter of request we can write in different format. It can be the display of referral letter, or maybe a branch of discharge letter. So whatever it is, you can see that it can be categorized as a referral letter, even if it's a discharge letter as well. Let's say we can write a letter to the occupational therapist. The job of occupational therapist is to do two things, maybe home placement, home assessment, or maybe the workplace assessment. So we are writing this letter. For example, if there is a patient who has been discharged after a knee replacement surgery, and at one point we have written this letter to the GP or maybe to the let's say community nurse if you're writing for the nursing. But within the same letter, now we are approaching to the occupation therapist to pay a home visit for the home assessment. Because after surgery, whatever the general practitioner or nursing team has to do, that is a different story. But I am talking about now the different story, a different request the specialist or the GP or the nursing team has to make from the occupation therapist to go for the home assessment. Hazard assessment at home, maybe understanding if there is a staircase, so changing of the staircase with maybe ramp, for example, or if the patient is in need of wheelchair or maybe frame or maybe stick. Accordingly, you have to see what are the important point. And let's say if the patient is having difficulty mobility, you can also add the let's say assistive devices if it's mentioned in the case, not from your knowledge, but I'm just giving you insight of the role of occupational therapist. If it's guideline that you have to write it down, like to the occupational therapist for home assessment. Afterward, we can see that if you are writing this letter to the occupational therapist and you are requesting occupational therapist to pay a visit at patient workplace, let's say in the same case, in case of discharge, patient has undergone a successful right knee replacement surgery and he has been improving after rehabilitation. He's able to walk maybe few steps and he can walk, let's say, whatever. So now we want occupational therapist to go for the workplace assessment. So hazard assessment at his workplace. So he might be interested about the nature of duties patient has been doing, right? About the let's say about the mobility patient can do, for example, range of movement, for example, stiffness, and the number of steps he can take, and then the nature of duties he was having. It's important for him to know to conduct the workplace assessment. Similarly, writing a letter to a physiotherapist in a case of discharge for the improvement of mobility, that is a different story. But in case of referral, separately, we have a patient who has a back pain and he has been improving after rehabilitation. Then we are referring to the occupational therapist. Maybe we can write to a social worker. Now, social worker would be engaged to help the patient to resume his normal life. Let's say even helping the patient in day-to-day tasks such as cooking, cleaning, and so on after the transition. We can also have the case when we write down the case to the pension care for the eligibility of the pension if the patient, even though has this surgery done, but now the patient is under crisis. So for that reason, we are writing this letter to the director of pension care to consider this patient regarding the need of pension. Okay. Then, and we can also write it down, this letter for the home placement to the director of nursing, so that he can assign someone that who will help the patient to do his daily task at home if the patient is, like bed bounded or the patient is handicapped. Similarly, we have a geriatric review, elderly age review, for example. So these are different displays of request letter we can expect in OET writing. The example that has been done for you, if it's a, let's say, discharge request letter, I'm writing to request you regarding Mr. James workplace assessment, as he has been recovering after a successful right knee replacement and want to resume his job. So we can write it down, the request letter, in this way. Similarly, we have the letter of transfer. It is basically a kind of transfer is kind of referral letter. Mostly people are confused with the transfer letter, but we can simply say that just the transport being involved, or maybe from higher hierarchy to lower hierarchy, we are transferring from higher hierarchy to lower hierarchy, from side stream to mainstream, the concept. But the transfer concept is as same as the referral concept. There is no difference in selection, there is no difference in organization, and so on. Anyhow, so now we can see there are, let's say, ward to emergency department transfer, that is departmental transfer, intra-departmental transfer, let's say. And now we can have the same specialty, let's say specialist to specialist transfer can also be categorized under the scenario of transfer letter, or maybe the referral or discharge letter. Then we have few words to confuse you, such as one-way transfer. The example is, let's say, transfer to hospice care. It can also be categorized as one-way transfer, right? Transfer to nursing home, from one nursing home to other nursing home due to any reason, right? We can write it down, this thing, from one nursing home to the other nursing home. It's your, let's say, your one-way transfer. Then transfer from GP to GP, old to new GP, can also be categorized as a transfer letter, right? Anyhow, the example that has been done for you. And lastly is the education letter. Less likely we can expect this type of letter, but yes, we have the letter of education, maybe general practitioner to community or residents, or maybe nurse to parents. Even though if you are a school doctor and you are writing this letter to the nurse, maybe if you are a school doctor, right? Or if you are a to the parents, sorry, or if you are a you can say, if you're a school nurse and you're writing this letter to the parents or community. So possibility, let's say, outbreak of chicken pox, or maybe like new contagious disease, such as, you can say, like to educate the people in the community about this disease, such as chicken pox, COVID, and so on. So we do have different format of writing. Like first we'll explain what the disease is, then we'll discuss about the prevention, and then we'll discuss about the treatment, right? This should be written in this way. Okay. So lastly, we can expect the letter of information. Information normally we write down to the health ministry, right? We also have the letter of information. General practitioner writing to the health ministry, like update on new disease, or maybe to the update of the existing health facility, is kind of information letter. So these are just an overview, a quick overview of the today's class with reference to the types of letter. If you like to ask any questions,